Hello, guys. I'm Oluwaseun Azeez, and I'll be taking this topic, PRISMA, a continuation of the first episode on PRISMA. Please keep in mind that it is important for you to have watched the first video on PRISMA to have an adequate understanding of PRISMA, of the previous discussion on PRISMA, before going ahead to watch this video. By way of an introduction, PRISMA is an acronym, and it's short for the preferred reporting items for systematic reviews and meta-analysis. The preferred reporting items for systematic reviews and meta-analysis. And it's a statement, basically a statement, a checklist that defines how or gives a guide as to how the methods and the results of systematic reviews should be reported in order to be reported in sufficient detail so as to allow the users to assess, that's the readers of such articles, to assess the trustworthiness and the and how applicable the findings of the systematic review is. Over the years, there have been several revisions to the PRISMA checklist. However, this discussion is going to focus on the PRISMA 2020 checklist, which is the most recent revision made to the PRISMA checklist till date. This discussion seeks to provide an understanding of PRISMA items 23 straight through to item 27. Items 1 to 22 had been earlier discussed by the previous tutor. Item 23 refers to the discussion aspects of the systematic review, and I would start with item 23A. In item 23A, the writers, the authors, are expected to give an interpretation of their results in the context of other studies. By this, I mean that the authors are expected to compare their own results to results of similar systematic reviews, by which I mean systematic reviews that address the same question using different methods or that addressed slightly different questions. And authors are expected to explore the possible reasons for discordant results, if there are any. This discussion is important as it allows the readers of said systematic reviews to have an understanding of how the systematic review links to other pertinent reviews. The 3B, the authors would want to discuss any limitations of the evidence included in the review. And this is in order to make it easy for readers to assess and properly evaluate the results. Therefore, the authors may want to discuss the uncertainties in the evidence, the papers which they included in their review. And this is in order to help readers interpret the results, the findings appropriately. A few of the possible limitations which could affect a systematic review and which the authors could find worthy of identifying is if the authors found very few studies that met the review criteria, if the authors included studies with a small sample size, which could be due to various reasons, could even be due to the fact that there were very few papers that met the eligibility criteria. Including studies with a small sample size could result in imprecise estimates, and it could even affect the generalizability, or how generalizable the results of the study is. Authors may also be concerned about the risk of bias, or they may have identified studies that only partially or indirectly addressed the research question. These are a few of the limitations that could affect a systematic review. In the previous item 23B, the authors sought to discuss the limitations with the papers, the evidence included in their review. In this item, item 23C, the authors seek to discuss any limitation of the review process used for their study. This is also in a bid to help readers understand how trustworthy the review findings are. A few of the possible limitations which could affect a review process are a decision by the authors to restrict eligible studies to studies in English only. This could be as a result of interpretation on the end of the authors. However, it could have an effect of screening out eligible studies which are in other languages. A decision to search only a small number of databases would also be a limitation, or a decision to have one reviewer screen records. Other limitations could also be an inability to access all potentially eligible study reports, or perhaps encountering unclear information and not reaching out to the authors to clarify such unclear information. There are several end users of a systematic review, from patients to healthcare providers to researchers to insurers to policymakers. And it is important that each of these end users understands the systematic review in their own contexts. That is, that each of them understands what actions they should take given the review findings of the systematic review. And this is where item 23D comes in. This item seeks to discuss the implications of the review findings for studies, for policy, and even for practice. Patients and healthcare providers may be more interested in the balance of benefits and harm, and then policymakers and administrators, on the other hand, may be more interested in how said review findings helps them to better utilize their resources. It is also important in this section, while making explicit recommendations for future research, to avoid general statements such as more research on this question is needed. Rather, recommendations should be better phrased, such as addressing the questions that further studies should, such as mentioning the questions that further studies should address, as well as the methods that could be used to carry out such studies. Well, item 24 of the checklist deals with registration and protocol of the systematic review. So it's usually helpful to register the systematic review. And that's because it helps to reduce bias, to increase transparency, to facilitate scrutiny, to strengthen the reliability of the systematic review, because people can compare what you specified, what you wrote, what was pre-specified, and what was eventually reported in the review. And then they can also decide if there were any deviations that could have introduced bias. It also helps to prevent duplication, because if all systematic reviews are registered, then the only thing authors need to do once to start a systematic review when they have their topic is to search and see if it pops up, and then they can tell if that work has been done before or not. So it helps to save time, helps to prevent duplication, unnecessary duplication of work. Yeah, unintended duplication of a systematic review. So usually for item 24A, you have to provide the registration number for the review, as well as where it was registered, the name and the number, or you have to state if it was not registered. So you want to state where the systematic review was registered, if it was registered in Prospero, in Open Science Framework. You want to also mention the registration number or the DOI as well. I mentioned earlier that one of the advantages of having a registration entry is that it helps to prevent duplication. I have to mention though that it prevents unplanned or unnecessary duplication. Duplication itself isn't necessarily a bad thing. There are instances whereby duplication could be needed. Um, a notable example being in the case of an update review, then a duplication could be very legitimate in such an instance. However, systematic reviews are time consuming and they require efforts. Therefore, it is helpful to prevent any unplanned duplication. Uh, a few of the host registers whereby a registration entry can be filed is Prospero and Open Science Framework. Prospero actually currently registers systematic reviews that have health outcomes, although it also accepts systematic reviews of animal studies, but then animal studies that have implications for human health, or methodology reviews that have a direct bearing on human health. So reviews, however, that do not meet that criteria for inclusion in Prospero could then be registered elsewhere. For example, the Open Science Framework, the OSF repository. However, both Prospero and OSF allow for registration without costs. So they're both free of charge. In item 24B, you want to state if the review protocol was prepared. And if it was not prepared, you want to state that the protocol was not prepared. If it was prepared, you want to indicate where the review protocol can be accessed. And this is very important because it helps the readers to locate the protocol more easily. So you can indicate by providing a citation, a DOI. DOI is short for Digital Object Identifier. So providing a citation, a DOI, or a link to the review protocol. And it's very important that this is provided because the review protocol might even contain some information about the methods that was not provided in the final review reports. It's also possible that the review protocol was conducted, was done, was developed, and but then the authors are not willing to allow access. If that is so, it should also be clearly stated so as to prevent users from wasting time trying to locate the documents. The importance of the review protocol is just to help as a comparison of um, as a document showing the pre-planned objectives and then the methods that was intended for the review and compare with the final methodologies that were used in conducting the review protocol and compare to see if there was a variation, especially if there was a variation that may have produced bias. So that is usually very, very important. So it is important to differentiate between the review protocol and the register entry. While both are public documents, they are distinct from each other. The registration entry usually captures key elements of the review protocol and is usually submitted to a host register such as Prospero, OSF, the Open Science Framework, ideally before starting the review. And then the register maintains a permanent public record of all that information, along with any amendments that the authors may choose to make, you being the author. These amendments that are made by the authors are then date stamped so that you have an idea of when each amendment, each modification was made. And then the register then issues a unique number in order to be able to link that register entry with the final publication when it is published. This is very different from a review protocol. For one, a review protocol is more detailed than a register entry. So a review protocol wants to outline in details, keyword details, wants to outline in details the pre-planned objectives and the methods that are intended to use to conduct a review. And this usually helps to avoid or to even to anticipate or to avoid potential problems before even going on to start the study. Usually, it's advisable that the review protocol be published in line with the PRISMA P guideline. The PRISMA P guideline is a framework, which is the PRISMA framework for protocols, the PRISMA guidance for protocols. So it's a checklist which provides a detailed step-by-step guidance on how to write, how to document a systematic review protocol. And it is advisable that a review protocol be written in line with the PRISMA guidelines for protocols, the PRISMA P. So it is very important that as the author, you make your review protocols public, and you can do that through various methods. You can choose to upload a PDF of the protocol to your Prospero registration record. So that would ensure that both your registration record on Prospero and your review protocol are linked. Or you can make your protocol a document on its own with its own DOI so that it can be cited across various documents. So you can even cite it in your Prospero registration record and in the full text of the completed review. And there are several ways to make your review protocol a document with its own DOI. One of the methods is by publishing in a journal that is open access or a journal that provides free access to such contents. Examples of those journals are the Systematic Reviews, BMJ Open, or you might want to publish in a journal using the Registered Reports Publishing Framework. So that way it can benefit from some feedback before you publish it. Or you might even choose to just publish to deposit your protocol in a general purpose or maybe an institutional open access repository, something like the Open Science Framework registries, amongst others. So that way your review protocol ends up being a document and has its own identifier, and then you can go on to cite it in your registration record on Prospero or even in the full texts of your competent review. In item 24C, you want to describe and explain any amendments that was made to the information which you provided at registration or in the protocol. So it is very difficult to anticipate all the scenarios, everything that will happen, that could require you to make some clarifications, to make some modifications to your protocol. Therefore, for reasons of transparency, it's very important that authors should report the details of any amendments that they made. So the amendments could be recorded in different places, could be recorded in the published protocol, like I mentioned earlier, could be reported as a supplementary file, could be reported in the registration record, could even be recorded in the full text of the review. So it's very important to report the amendments, and then the amendment should be reported noting the amendment made itself, the reason for the amendments, and the stage of the review process at which said amendment was implemented. And all this also is in a bid to just aid transparency, so that readers. So just like in any research, it is important also in the systematic reviews for authors to be transparent about the sources of supports which they received to conduct the review. So, and this support could be in various ways. For example, funders might actually have provided salary to researchers to undertake the review. It could be that some companies, some services have offered their services for translation of some articles. It could be that it could be in the release of a software to manage or to analyze the study data. It could be access to commercial databases that might not have been available otherwise. So it is very important that authors mention and describe the sources of their support, all support, whether financial or non-financial, and they also give a description of um, the founder's roles as well, the founder's roles in the review. It's possible, for example, for the founder which could be an individual or an organization. It's possible for the founder to have contributed to defining the review question, to have determined eligibility, to have collected data, to have analyzed data, to have been involved at several stages of conducting the systematic review, and this could introduce a potential for bias in the review findings because, as unsurprisingly, the founders could have an interest in obtaining a particular result. So it's very important that the sources of financial or non-financial support for the review should be explicitly stated by specifying the relevant grants ID numbers for each of these funder. If there was no specific financial or non-financial support that was received, then that should also be stated. It's important to also describe the role of the funders. If the funders also had no roles in the review, it should be stated maybe by saying the funders had no role in the design of the review, in data collection and analysis, in the decision to publish, or in preparation of the manuscripts. In item 26, you as the author would want to disclose any conflict of interest which could affect the credibility of the systematic review. Um, and this could be done, you could do this by following the format of the publishing entity or by using the ICMJ disclosure form. That's a disclosure form of the International Committee of Medical Journal Editors. This is all in a bid to just reduce bias. It is also important to also mention that if there are authors with such competing interests, it is important to report how they were managed for particular review processes. So this could be managed by preventing such authors from performing risk of bias assessments. Finally, item 27, which deals with how data is shared. So it's important to share data, to share analytic code, all the materials that are relevant to the systematic review. It's important to make them publicly available. And such materials can include the templates data, collection forms, all the data extracted from the included studies, uh, could also include um, data sets, the data sets used for the analysis. So for the data sets, you can store it, you can make it a CSV file. Could also be a README file, metadata, and could also be an analytic code used for, let's say, software for the analysis, could be an analytic code or the steps used to run all the analysis. And it's important that all this information is made available, publicly available. So there are different ways of making such data available. One of the ways is by uploading such data to a publicly accessible repository, such as, once again, the Open Science Framework, Dryad, Figshare. These are a few of the publicly available repositories for data for systematic review data. It's important while finding a place while uploading your data to consider the FAIR data principles. That means FAIR stands for findable, accessible, interoperable, and reusable. So it's important that these four criteria are followed while sharing the data. So it's very important to report which of the data is publicly available. If any of the materials is publicly available, to report where such material can be found. You can provide a link to such files after depositing in a public repository. You can provide a link to such files. And if you want the data to be available only on request, it's important to provide the contact details of the author responsible for sharing the materials, and also to describe the circumstances under which the materials would be shared. In conclusion, this is the PRISMA framework, the preferred reporting items for systematic reviews and meta-analysis. And if followed, it would lead to a more transparent, complete, and more accurate reporting of systematic reviews, thereby leading to the generation of higher quality research. Please find in the next couple of slides my references and also links for further reading. Thank you for listening.